The National Hospital for Neurology and Neurosurgery in Queen Square, London, is about 150 years old. It's a specialist hospital for neurology and neurosurgery. And we get patients referred to us from all over London, parts of the UK and parts of Europe. I'm one of the doctors on the intensive care unit. The ICU is a specialized unit in the hospital that cares for patients that require close monitoring and support following a significant surgery or that have been admitted with life-threatening emergencies.
Intensive care specifically, all care is very individual. So we really work hard for holistic approach.
And that means everything, not just the physiology bits about, caring for the patient's mouth care, eye care, ensuring that the dignity and privacy is all maintained as well.
We care for these people to the high standards that we would want our family to be cared for.
Currently, visiting is very restricted. It's for everybody's safety. The nurses look different in full PPE, but the care remains the same.
In the ITU, we have a 1-to-1 ratio, so there's a trained qualified nurse with that patient at all times. And in the high dependency, there's one nurse between two patients. But it's not just about the nurse at the bed space. Behind that nurse is a big team supporting them.
Care on the intensive care is led by a consultant, and there are twice daily ward rounds led by a consultant. Patients also get visited by the admitting team, whether it's a neurologist or a neurosurgical team.
From that ward round, we will raise any issues with the other teams involved, whether that be physios, maybe dietitians, speech and language.
And all decisions for care are made as part of a multidisciplinary team conversation. These decisions we communicate back to the family and the patient if they're able to understand.
In ITU, we monitor the patient head to toe.
There are lots of tubes and lots of very technical parts of equipment, which can be very overwhelming for relatives.
But really the machines are there just so that we can ensure that the patient remains stable and to give us information.
Communication with the relatives is so important. If I am the relative, of course I want to know what's going on. So you will be given regular updates by either the nurse or the doctor. You can also call us anytime.
There's always somebody to talk to. Bearing in mind that in the morning there's a lot of information gathering, so there's the ward rounds, the therapy teams come in. So the best time to get a fuller update would be in the afternoon.
We welcome all kinds of information, whether that be about social background, about the family dynamics, what patients like, what they don't like.
We also like to know their belief and customs so that we can include it in our nursing care. For example, some relatives want us to play religious songs at a specific time of the day.
I've asked relatives to send photographs in of their family. I want the staff to know this is what they mean to their family. This is what they are like when they're not in the hospital bed.
Now what we're trying to do is we are arranging for video calling so that they would still have that connection.
We're trying to do as much as we can to bring the two worlds together when we can't.
So even if the patient's unconscious, we've sometimes had the relatives talking on the phone.
Even if it's just the phone on the pillow and you're able to talk on speakerphone, just talk about normal stuff. And we try and talk about normal stuff in between as well and let them know what's happening with the weather, what day it is.
So it doesn't matter if a patient is conscious or not, we assume always 100% that they can listen to us. We still hold their hands, wash their hair. We do the small things that we think matters.
If you want to bring a radio in, a bit of music is always fun.
Maybe you could rearrange the bed space so they could see out the window, try and get a right cycle, so nighttime you try and dim the lights, try and reduce the noise, so you can make everything more homely in a sense.
There's a very wide range of people that we see here, so you will have people who are incredibly unwell on the most support that we can give them. But for lots of people, that's just the start of their journey.
It's quite a lot to go from lying flat to sitting up, and we're mindful that that might make you feel a bit dizzy. We'll take it quite slowly.
As therapists, we get involved very early, so we would be helping with sort of the ventilation management if they are on a ventilator. As they're improving and progressing, we'll also be very much part of their management with regards to strengthening, getting back on their feet, getting going again.